Community health centers across the state are facing a crisis that not many people are talking about now, and it could start affecting the health care of thousands in the next couple of weeks. Chief Political Correspondent Mark Davis live in our Hartford newsroom tonight to explain. Mark.
Hi, Darren. Good evening, everyone from the Hartford newsroom. This is some of the fallout from that federal government shutdown last month. 1 out of every 10 Connecticut residents go to one of the 17 community health centers across the state for their medical care. But some of the over 375,000 patients are facing the prospect of curtailed services. And some of the nearly 3,000 healthcare workers are facing the possibility they could lose their job.
All the community health centers are on edge because the financing for our federal dollars has not been resolved. And that's the biggest challenge we have.
Statewide, it amounts to about $40 million. For the healthcare centers, it means making tough decisions in the event Congress doesn't have a long-term budget deal by a week from today.
We'd be looking at approximately 530 staff being lost as a result of this. About 25% of our patients would actually be potentially unable to receive their services.
Senator Chris Murphy says this is one of the big reasons he voted against that continuing resolution that ended the federal government shutdown last month.
This is a crisis that hasn't been getting a lot of attention. These health centers are due to run out of money in a couple weeks because Republicans in Congress haven't reauthorized their funding.
This is another one of those issues where members of Congress from both political parties agree that these health centers should be funded, but they can't get together on a solution for bigger issues like immigration. Live from the Hartford newsroom, Mark Davis, News 8.